Hello, everyone. Thank you for joining us today. My name is Erin Morgan. I am the editor-in-chief of Eye Care Business Magazine, and I am excited to be here today with Dr. Melissa Barnett. Thank you, Melissa, for joining us today. We really appreciate your time and glad to be able to chat with you here today.
Well, thank you so much. And thank you all for attending. It's great to be here too.
It is great to be here, and I'm looking forward to our conversation. So, folks, if you're here watching, we're going to talk today about some really interesting, Dr. Barnett has a real critical specialty in dry eye, which obviously is a huge topic of discussion, huge area of need today. It's very important in a practice to have that knowledge. She's going to share, some of her knowledge with us today. We're going to go and talk about kind of ways to deliver excellent care and then also treatment solutions for dry eye patients. In particular, we're going to talk a bit about Regenerized Light, which is available through ABB Optical, and it's a product that Dr. Barnett uses in her practice as well. So we're going to talk about dry eye disease management and product solutions, treatment solutions for that as well. And she can tell us a bit about how that's helped her patients and as well as other effective solutions that she's used. So Dr. Barnett, can you tell us just a little bit, for our audience, tell us a little bit about yourself, about your background in practice and with dry eye and in the industry?
Sure. Well, thank you. So I practice at UC Davis. I practice in a few different practices, 3 actually, for UC Davis. So one, I do a lot of specialty contact lens and scleral lenses and dry eye and research specifically in Sjogren's syndrome and dry eye. It's a very medical-based practice, and actually wrote a book on scleral lenses too, which I encourage all of you. Yeah, it's going to be translated into Spanish soon, so very exciting.
Fantastic.
Wrote a guide on scleral lenses that's in about 5 languages. So do a lot of scleral lens work. I love it because it really changes the lives of patients. A different practice is a kind of a general disease practice, and then I'm also on campus seeing students. But dry eye is found in all of these different populations, and I think the pandemic, unfortunately, has made the ocular surface much worse, and now we have mask-associated dry eye too, because the hot air is blowing up from our face masks and making the eyes more dry. And we're on digital devices more than ever before too. So we're seeing tons and tons of dry eye. I think we're seeing more dry eye now than we ever had before because of the pandemic as well.
No doubt. Yes, certainly a lot of digital device usage and more for people of all ages, for sure.
Yes.
So, well, thank you for that. That's great to know about your background. And so I assume you're there in California as your home base.
Yep.
That's great. Well, folks, just a quick, before we get into our Q&A session with Dr. Barnett, just a quick welcome again to everyone here watching. And we love to know who's here. We love to know who's joined us. So please feel free to, in the comment bars in YouTube or on Facebook, please type in your name, your practice name, or where you're from, what town you're in. Please tell us where you're at, and we love to give a shout out and see who's here. So thanks again for joining us. So Dr. Barnett, I'll just kick off, kind of by saying, we're really interested to learn more about your innovative solutions to dry eye treatment. Obviously, you've worked with it for quite a while. You are a real expert in the area, and then also to kind of learn a little bit about product solutions, treatment solutions, such as Regenerized Light, which is available through ABB, and it's been a key go-to solution for your practice. So, can you tell us, just to kick it off, tell us a little bit about your own dry eye practice there?
Right. So I think it's really important for everyone with dry eye to make the approach very customized and personalized, because everyone should be screened for dry eye. Every single patient that you see, whether a patient's coming in for a vision exam or a medical exam, you have to rule out any dry eye and ocular surface disease. So I really like to include questionnaires because they give a very validated starting point, and then we can check the questionnaires from visit to visit to see if the dry eye management solutions are working. I like to look at the eyelids and lashes, evaluate for meibomian gland dysfunction and blepharitis and Demodex. I always like to have my patients close their eyes to look for things like lag ophthalmos and incomplete eyelid closure. And I do a lot of dry eye and I do a lot of contact lens. And I think it's really important to evaluate the surface, the ocular surface, prior to fitting contact lenses, because they just go hand in hand. So if we're doing a normal cornea contact lens, really optimizing the ocular surface to the best of our ability prior to fitting the contact lens. And then if it's a specialty contact lens, oftentimes like a scleral lens, we do need to fit the lens, but also really going over different management solutions for each individual patient. So going back to the questionnaires, I actually learned this tip when we did some research on Sjogren's and dry eye, where I went back to my charts over 5 years for patients with Sjogren's. And I learned that, gosh, these questionnaires are really, really helpful. So I would invite everyone, because that's very simple to do. You can give patients a questionnaire, they can do it online, they can do it with a paper form, and you don't need a lot of like expensive equipment and things like that if you want to start a dry eye practice.
That's great to hear. And I love the questionnaire concept. It really, I'm sure you get so much information, valuable information from that, that's right there. You can keep in their file and refer back to, as needed, but also for obviously the exam as well. So that's a fantastic idea. Thank you for those tips and for sharing a bit about how you operate in your own dry eye practice. So can you tell us a little bit about what your own decision journey has looked like in terms of managing your dry eye patients? What insights can you give about utilizing different solutions and why are they chosen?
Sure. So I always like to know what patients have tried, and I have a whole variety of patients. I have those who are brand new to me. I've never seen them before. I have those who've seen 4 other doctors and then they come to me, and because other things have not worked. And so I always like to establish what they're using and what has worked and what hasn't worked. And I'll give a really helpful hint here, and that's the use of artificial tears. So, for example, there are artificial tears with BAK that we know is really drying to the ocular surface. And patients can be using artificial tears many, many times a day and can cause a lot of ocular surface disease. I have patients who've been on different prescription products, topical immunomodulators that haven't really worked. So then I think, well, we have another option, such as Regenerized Light, that's different. It has different mechanisms. It approaches the ocular surface in a different way, and include that in the management for these patients. Now, I will say when I'm treating my patients, it's not one thing. It's multiple things that I'm telling them to do. So oftentimes eyelid hygiene, so using warm compresses, using a hypochlorous acid eyelid cleaner to really optimize the ocular surface. And one of my favorite studies that I like to share with my patients too is the use of the Bruder compress increases comfortable wearing time of contact lenses by about 3 hours. So this is,
Wow.
It's not my study, it's from the Nichols from UAB. It's a great study, and I think it's really practical, because we want patients to be very comfortable in their contact lenses, not only at the beginning of the day, but at the end of the day. So, and it's also motivating. Like, this is an actual study that shows if you use a compress for 10 minutes once a day, you can be much more comfortable with your contact lenses. So when it goes back to dry eye, I don't want my patients thinking about their eyes. I don't want them worried about their eyes. I do not want their eyes to be painful. I also right now want to keep my patients, every patient, out of the emergency room. And that might sound crazy, but we've been open this whole time during the pandemic. And there's so many people that go to the emergency room for eye-related issues. And dry eye is one of them, which is incredible. Absolutely crazy. So I don't like any emergency dry eye visits. I want to keep the ocular surface really optimized to avoid those. Now, tear film homeostasis is so important. So when we're talking about contact lens wearers, even those who don't wear contact lenses. I mean, the tear film is so incredible and fascinating, and it really helps with the normal blink. So we like to talk about blinking and the importance of blinking, computers and digital devices, and appropriate viewing of computers and digital devices as well. But it all goes back to that personalized protocol. So it's really different for every single one of my patients. You say, you ask me the question, what do you do for your patients? It really depends on the patient. So if it's someone who has mild dry eye, I'm probably going to be talking about eyelid hygiene and warm compresses and artificial tears that don't have any preservatives. But as we move into the moderate to severe, it's nice to have different options for them. And I find that Regenerized Light has really helped those patients in the moderate to severe categories. And again, I just never want them to get to the painful part or you're coming in on an emergent basis.
Absolutely. Most definitely. Well, that's a great approach for sure. So, and kind of related to that, or kind of jumping off of that, it's been found that early diagnosis, early management of symptoms with effective solutions, obviously, will lead to less complicated treatment decisions in the end, and provide satisfaction to both the patient and, to the treating doctor. So how do you increase dry eye awareness in your practice with your patients, and also just kind of in your practice in general?
Sure. So I do screen every single patient for dry eye and ocular surface disease. So I ask my patients about digital device use. I ask them about face masks now and how many hours a day they're wearing a face mask, because it can vary widely. We've also seen horrible infections this year due to the face mask usage. But really, you can think about dry eye and the ocular surface like your hands and hand lotion. So you just, you put on hand lotion in the morning, you might put it on before you go to bed. Same thing with artificial tears. So we can use them in the morning to just kind of lubricate the eyes, in the evening to lubricate as well. And then I always go back to the dental analogy for the eyelid cleaner, which patients understand, right? So using a warm compress like the Bruder compress to really loosen up those oil glands, the meibomian glands, to provide that nice smooth surface. And then using that Vibrant View eyelid cleaner, the hypochlorous acid, can really just get rid of all that debris. So that's kind of in the early stages there.
Sure.
My patients who are compliant do really well. Now, I also talk a lot about diet and nutrition and just lifestyle as well. So drinking water, not drinking too much coffee. I'm a big fan of omega fatty acids. There are great studies looking at vitamin B and vitamin D and turmeric, actually, how it helps the ocular surface. So, and I learned that multiple years ago in the scleral lens space, when we didn't have the great materials we have now and designs that we have now. And I was having so many issues with the ocular surface. Now things are much better because we have really advanced technology. And then don't forget about scleral lenses, which are tertiary therapy for dry eye. And there are many excellent designs out there. We even have multifocals for those who are presbyopic. So there are so many different things that we can do, and with success for our patients with dry eye.
That's fantastic. Well, I see, thank you for all of that great information. I see more and more folks hopping on here. I just want to let everyone know that if you do have questions for Dr. Barnett, please go ahead and type those into the comment bars on YouTube or Facebook, and we can get to those live as we go through here. I have about 2 more questions for you, Dr. Barnett, and then we could address any audience questions that come in. So folks, please type in your questions into the comment bars if you have questions, and we'll address those as soon as we finish up here with these last 2 questions. So can you share a little bit about how Regenerized Light has worked for you and your patients as a key solution to treating dry eye? And are there other solutions? I know ABB has a dry eye portfolio that you've utilized with success. Are there other solutions, in addition to how has that Regenerized Light worked? And then what other, kind of products in that portfolio have worked for you?
Oh, sure. So Regenerized Light has worked for the majority. They've been my patients with that moderate to severe dry eye and Sjogren's syndrome. So I would encourage all of you, if you have a patient that does have dry eye, male, female, it doesn't matter, to ask about dry mouth and arthritis, because we want to diagnose autoimmune disease early and keep in mind that any sort of systemic flare will have an ocular flare as well. And right now it's allergy time in California, so we're seeing lots of that.
Definitely.
But light has been really helpful for those patients where other things have not worked, because it is a newer product, of course, and it can be distributed from practices, not necessarily our practice, but it is something that can work within about 6 weeks time. I would give it about 6 weeks time, but some of my patients say like right away, within a few days, their eyes feel better. Others, it takes a little bit longer, but that is one solution. As I mentioned, I'm a real fan of the warm compress because I think it's very soothing, it's very relaxing. My patients call it spa-like, which is great. And everyone wants to be at the spa, right?
Absolutely.
And some people like doing it in the morning, some people like doing it in the evening, it doesn't matter. So I do like to talk about how that can benefit the ocular surface. And then really good contact lens hygiene, of course, is so important. There are all these rumors that went out last year that contact lenses are not safe to wear. They're completely safe to wear, even now. Importance of washing hands. So there's actually a new cleaner that can be used, a Vibrant View hand cleaner, which patients really like. They want clean, healthy hands prior to putting on their contact lenses. There's also a new solution that can be used in the bowl of the lens to apply scleral lenses as well as the eyelid cleaner. So these are just a few of the products that we've used in our practice with success. And there are just so many, different ways. And I think what really goes back to the importance of the customization for each patient. So some patients don't like using eye drops, for example. Some patients love using eye drops. I mean, everyone is so incredibly different, but it is important to go over where they are now. So that's why the questionnaires are helpful, how we can help and how we can help them so that they don't have to think about their eyes or worry about their eyes. And they just feel really comfortable. And then we can also talk about all of the cosmetic benefits that having a nice ocular surface can provide. So eyes are more white, they're not as red, they don't look as tired, patients look younger. My patients tell me all these things. So I don't really focus as much. I always focus on the ocular surface, but there are multiple benefits. I always love when a patient comes back and says, oh, and by the way, my eyes look whiter. They don't look as red. And people tell me I look more awake. I mean, that's another benefit of treating the ocular surface.
Yes, at least I know I need all the help I can get. So I'll go for that for sure.
We all like to look younger.
Definitely. So that's great. Well, I appreciate you sharing that information. My last question, and I don't know if we've covered it yet, with all the different solutions that you've utilized, is there anything else that you utilize to provide patient satisfaction in your practice?
Well, I think it's important to be aware of dry eye. And I will just share the economic impact of dry eye. So if patients are just going to a store and purchasing multiple products without your recommendation,
right,
then they're going to spend a lot of money and not necessarily get a lot of relief. And these things can add up, all of the different products. So I would recommend or prescribe different specific products for each patient, and keeping realistically cost in mind, but giving them just the best possible scenarios so that they're to help their ocular surface, and also so it's not such a burden for cost for the patient.
Definitely, that's true. Very good point. Especially if it's an ongoing thing and there's ongoing costs involved, for sure.
And one more thing is that, of course, is a chronic condition, and it's important to educate our patients about that. So it's not that we're going to give them one thing and then it's
Right.
just
It's over.
they're going to be fixed forever. And so addressing the eyelids and lashes, addressing that tear film, really helping them, but also explaining the chronicity and looking at their medications. What systemic medications are they taking? Are they taking something like an oral decongestant for their ocular symptoms, where we could give them just an eye drop to help instead that does not dry their eyes out? You know, looking at the whole big picture for each individual patient is really important.
That's great. And that's also great food for thought for the questionnaire, I imagine, you know, to kind of add any of those types of questions or lifestyle questions kind of onto someone that's might be watching, that kind of thinking, what am I going to put on my questionnaire? You know, but those lifestyle questions and kind of, you know, management questions are definitely really helpful, I'm sure.
And asking
So,
how many digital devices a patient has. So the average is 3, but some have 5 or 6 for one person. I mean, it's crazy.
it is crazy. Very good point. And also, you know, kind of how much time they're spending on those, you know, each individual device. And obviously, some of them are at different, you know, distances as well.
And don't
So, a
forget
lot
the
of,
20-20 rule. So
yes,
every 20
exactly.
minutes, look away, 20 feet away for 20 seconds, take a break.
I have been telling my daughter that, who's been, you know, homeschooling on the computer all year. So, keep saying 20, 20, 20. I'll run by, yeah, and shout that into her room. So been a very helpful tool for sure.
Very good.
Yeah, well, thank you so much for joining us. We really appreciate all this great information, such great insights and you know, really usable tips that people can walk away with. And really great product information too. There's, you know, there are great solutions out there for patients. And this ABB dry eye portfolio is a fantastic solution because it has a lot of different products, including Regenerize Light in there, that can really, really be a wonderful practice tool. So thank you for sharing all of that, Dr. Barnett. We appreciate your time today.
Oh, thank you. This was great fun. Thank you so much.
Great to see you. And thank you all for joining us. We appreciate it. And keep tuned. We'll have more. Stay tuned. We'll have more live streams coming down the pike soon here on Eye Care Business's Facebook and YouTube channel. So thanks for joining us today, and we'll see you soon.